Small mammals are the next group we will consider. Rabbits, guinea pigs, ferrets, and pocket pets, or the smaller rodents such as rats, mice, gerbils, hamsters, will be discussed. All these animals are common prey species in the wild and often behave as such. Rabbits probably require the greatest attention and care. This is because their back legs are so strong that a forceful kick during restraint can dislocate or break their vertebra, resulting in paralysis. Rabbits seem to come in two personality types. First, the house pet that gets lots of attention can be quite congenial, or at least tends to be relatively still. But rabbits that get minimal handling are frequently wild and will run, jump, and kick when approached. Be aware that even the most socialized rabbit, when threatened with restraint by a stranger, may suddenly act wild. Pet rabbits may be handled by the owner. Place a towel on the exam table and set the bunny on it. The towel provides a less slick surface for the rabbit's feet and seems to keep him calmer. Also, the towel can be folded back over the rabbit to protect him from kicking. Notice how the handler of this bunny uses the towel to restrain the back and sides, leaving only the head exposed for examination. As the examiner works back, the towel must be adjusted to expose areas of interest. Some potentially startled rabbits will calm down after the head is covered with a towel. If the rabbit comes in a carrier, he may be sweet-talked to walk right out onto a towel. Be ready, as he may bolt out of the cage and wind up on the floor. Rabbits that are more wild or skittish may have to be caught from their box or cage. We typically use a towel. Place the towel over the entire rabbit, including the head. Scoop the rabbit up by squeezing the towel under his legs and lifting him up. The towel should tightly cover him to prevent him from diving out the front or getting a fully extended kick out the rear, both of which may have disastrous consequences to your patient. Once out of the cage, place him on the table wrapped in a towel. It is a good idea to keep his rear legs restrained by holding his shoulders through the towel with your hands and snuggling him back against your body. Note that rabbit exams, unlike bird and reptile exams, are typically done with the rabbit standing on the table, wrapped in or standing on a towel. This keeps the patient calmer. Sometimes rabbits need to be picked up to be moved or to look at their underside. To carry a rabbit, hold his scruff like a cat while resting his legs in your lower arm. The lower hand should support the rear legs. They often feel secure by burying their face into your elbow, as seen here. Never carry a rabbit with his rear legs dangling, as this is the easiest position for them to kick and break his back. To examine the underside, cradle him like a baby in your arm crook and hold his legs. When putting a rabbit down into a cage, always set down the rear feet first and place him in backwards. Guinea pigs are handled similar to rabbits, with the exception that back dislocation is not a concern as with rabbits. They can be scooped up by hand or with a towel and gently restrained on the table. To control the head, simply grasp them around the base of the skull, supporting the jawbones with your thumb and index finger. They can easily be picked up and turned over to examine their underside, supporting the head and neck as previously described. Most ferrets are docile, and assisted restraint may not be required for the basic examination. Ferrets that are unsocialized, biters, or those undergoing certain procedures such as a rectal temperature may need assisted restraint. The best way to restrain ferrets is to scruff the skin of their neck and let them dangle. This usually subdues the wildest of ferrets and frequently elicits a yawning response to allow oral examination, otoscopic examination, and evaluation of the rest of the body. It is also a good way to hold them for procedures such as injections and rectal thermometer placement. More docile ferrets can simply be gently held on the table to prevent escape. A trick that may help with injections relies on ferrets' love of foods such as Nutrical or Ferritone. Place a little Nutrical on a tongue depressor and offer this to the ferret. About 50% of the ferrets will gobble this up, paying no attention to the injection. Rodents are tricky to handle because of their small, delicate size and their propensity to bite when scared. Pet rats are usually the friendliest rodent to handle. To remove a rat from its cage, grab the base of his tail or his shoulders and neck. To restrain a rat, hold his neck and shoulders with your thumb and forefingers, supporting the base of the skull and back of the lower jaws. Many can be lightly restrained on the exam table, like a ferret. Smaller rodents, if not too nervous, can be scooped up in the palm of your hand. Many may be examined with such mild restraint, but full restraint calls for scruffing the animal. Mice, gerbils, and rats can be lifted by the base of the tail and hung such that the forefeet rest on the table. With the rodent distracted by his escape attempts with the forelegs, approach from behind his neck. With your thumb and forefinger, gently pin down the head to prevent his turning and biting. Then with the same fingers, grasp the loose skin at the nape. Use your other fingers to support his back and trap the tail with your pinky finger. Be careful not to hold too tight, as this may restrict breathing or hurt his eyes. Also, when grabbing the tail, be very careful to grab toward the base and not pinch too hard. Gerbils especially are prone to losing the skin off their tail if grabbed too close to the tip. Hamsters are a bit different. They have no tail. To fully restrain a hamster, use the scruff technique described above. Since they have no tail, you will have to go straight for the neck while he's on the ground. After the skin is scruffed, you may need to use your remaining fingers to scruff the skin over the back. This helps pin the body down so he won't twist around so much. With all these rodents, try to keep restraint time at a minimum. Remember some basic principles. Keep the patient's safety first, then the safety of the handlers and doctors. Move confidently and quickly when capturing an animal. Use firm and adequate restraint to keep the patient and handlers safe, but don't over-restrain or grip too hard. Only practice, continued study, and development of your skills will bring you the confidence it takes to handle these and other species not specifically studied thus far.